Welcome back. That was an interesting report on kids' health issues. I'm here today with Dr. Ashraf Azaz. Hello and welcome to our show for tonight.
Welcome.
Can you tell us more about your specialty in the field of medicine?
I am a specialist in pediatric, all diseases including pediatric, also the neonatology. The item of neonatology is the infant from 0 day until 1 month age.
Very interesting and very vital and important for every parent and every kid as well.
Yes. It's the first year of life of the baby. It's a very important year and it is the most common disease occurring in this year.
Yes, we're going to talk a lot about those common diseases tonight for all those parents and kids in order for them to avoid those type of diseases.
Yes.
Can you tell us more about your studies, where you studied, and then we'll follow up with all the diseases.
Yes, I take my master from Faculty of Medicine, Qasr Al Aini, Cairo University. I have membership in infection control from American University. I have a certificate from quality management, also from American University, and some certificates including infection control, including the NRP, how to resuscitate the newborn baby, and also I am a member in Kuwait team, how to train the doctors, how to assess the newborn, how to resuscitate the newborn in the incubators.
That is definitely very important and vital job for you to do.
Yes.
And we'd like to talk more about the common disease that you're seeing right now at the clinic.
In pediatric, we have seasonal diseases. Like in winter, we have chest infection diseases is common. But in summer, we have many diseases which are affect the children. The most common disease that affects the gastroenteritis. This is a most common disease, and nowadays it is highly spread and have many effects on the children.
Yes, it's so sad, and we'd like to know more about the symptoms of this type of disease.
Firstly, we wanted to clarify what's the definition of gastroenteritis, because there is misunderstanding about the definition of gastroenteritis. Gastroenteritis by its name is a diarrhea. When the child comes with diarrhea, this item is gastroenteritis. Sometimes has associated with vomiting or no. But if the child comes with vomiting only, this is not a gastroenteritis, it is a gastritis.
Okay.
So there is a misunderstanding about this issue. Some doctors or some family suggest that a gastroenteritis when the baby has vomit only. No. This a gastritis. But the definition of gastroenteritis is a diarrhea associated with vomiting or no. It is a common disease.
So it has to be both of them together in order to have that sort of disease.
Yeah.
Can you tell us more about how it could be treated? Because it would definitely be so hard on the kid and child themselves. So how could they get treated and quickly?
Gastroenteritis is a self-limiting disease.
Okay.
What's a self-limiting disease? It takes about 3 to 5 days and then recovered completely. But we avoid the dehydration. The most common complication of gastroenteritis is the dehydration. So we advise all families to give fluids for her kids.
Yes.
There is no rule of antibiotics, there is no rule of antidiarrheal in treatment of gastroenteritis, because most common cause of gastroenteritis is a viral infection which is called rotavirus, which is
and this comes with the change of the weather, or especially in summer, or do we also see it in winter?
I think in our countries, because there is different change in weather, there is no differentiation between summer or winter. But the gastroenteritis is a common disease in children, especially from 1 year to 5 years. And this disease kills about 300,000 to 500,000 kids all over the world every year below 5 years. Yes.
That's really
very
sad.
Dangerous.
And the statistics are huge.
So
how could we avoid this type of disease?
We can avoid this disease from the start of life. Why? Because we have what is called the vaccinations against rotavirus, which is a common.
Can you tell us more about when they should take this vaccine and what is included in the vaccine itself?
Yeah. The rotavirus is a common cause of gastroenteritis.
Okay.
So we vaccinate the child or the infant from the first days of life. 45 days we give the first dose of Rotarex. This is a vaccination against against
and when
gastroenteritis.
is the second time that they take the vaccine, or
After
do
a
they
month,
not need
after
it?
a month from the first dose.
Oh, okay.
After the 1 month, the first dose, we give the second dose of Rotarex. This Rotarex vaccine here in Kuwait, not in the routine vaccination of child, but in other countries, there is in the routine vaccination. In developing countries, this vaccine prevent about 34% of gastroenteritis.
Okay.
But in developed countries, I think it prevent about 90% of the gastroenteritis, because the gastroenteritis is highly dangerous in the children below 5 years. This vaccine has statistics, and as we see, decrease the incidence or prevent completely the gastroenteritis in the children below 5 years.
So either way, they should get it, the vaccine.
Yes.
And the follow-up, can you tell us more about the cultural follow-up?
This is our message for all families, because we usually tell the mother, don't wait your child to become sick to go to the doctor. The good culture is the follow-up. Every mother or every family must follow the program of the follow-up.
And how frequently should they visit the doctor?
The follow-up in the first year, the child must visit the doctor 9 times.
9 times
Yes,
a year?
9 times. The
Okay.
first visit 1 week after birth,
Okay.
and then every month in the first 6 months is 1 visit. Then the 8 in the 9 months, and the last visit when he complete 1 year. After 1 year, the child must follow his doctor every 6 months. Why? Because the look of the doctor is completely different from the look of the mother, and the assessment of the doctor is completely different than the assessment of the mother. Also, during the first year, me as a doctor can add some routine medications like vitamin D.
And what are the different things that you take in consideration during those visits with the baby, the newborn, the infant, as it grows and develops? What are the certain things that you're looking for?
Yeah. Routinely, firstly, I add some medication routine from the first day of life, like vitamin D to prevent what is called rickets. After 6 months, I add iron to prevent iron deficiency anemia. Also, sometimes I suggest some diseases,
Okay.
and ask the family to do some investigation or some images to sure that is the disease, because sometimes some diseases cannot be discovered as symptoms, but I can discover from the attitude of the baby. In the first 3 days, we have more than 80 rare diseases. This disease must be discovered by what is called neonatal screening. We do what's called the neonatal screening to discover more than 80 diseases. These diseases may lead to handicap.
And what are some of the common diseases that are there since birth? Can you tell us more about those?
Since birth, there is not summer disease. We have sometimes some diseases common in the first day from the birth, like neonatal jaundice. The mother comes to tell us there is a yellowish discoloration in the eye, yellowish discoloration in the body of the baby. This is a neonatal jaundice. Neonatal jaundice is the most common disease, or this most common phenomenon in the newborn. It occurs about 80% in a full-term baby, and also 85% in a low birth baby. Neonatal,
so it's very, very,
very
common. Can you tell us how it could be treated and some of the things that we should do to avoid it in the future?
There is the treatment depends on the cause of jaundice, because sometimes we have a neonatal jaundice due to hemolytic anemias. So this may be exchange of his blood. But the physiological jaundice can be treated by phototherapy. This is apparatus present in the incubators. The baby put in the light, under the light, and take about 3 to 5 days and then become completely normal. But the neonatal jaundice is a simple disease. In the same time, it is a very dangerous because the bilirubin, this is the substance, can cross the blood-brain barrier and leads to CP or leads to some damage in the brain.
Very interesting.
Yeah.
Can you tell us more about chickenpox, what it is, and when is it that kids normally tend to have it?
Chickenpox, this is a viral disease and it is common nowadays. Chickenpox has a problem. It is a simple disease but may lead to some dangerous complications like damage of the brain, like damage of the kidney. But no doctors can discover the chickenpox from the start because the initial symptoms of the chickenpox is simply like common cold, like so nobody, no doctor,
so
no
it
family.
could be mistaken with any other disease.
Okay.
And how can they catch it?
Catch
Young
it
kids?
only when there is the characteristic rash coming on the body of the baby. But the problem, before the appearance of this rash, the child is highly infectious. So if the baby have this chickenpox and go to his school, he can transfer this for all his class. Yes. So this is the problem. When the rash appear, we can catch this disease, but there is no treatment for it except something to prevent infection, something to prevent itching. But we can prevent it.
And is it better that the young child catches it, and what certain age should they get it in order, because I believe it's a one-time sort of disease that you get in your life. So it's better, some people would say, that you get it at a certain age than getting it either older or really young.
No, this is a bad attitude because if we let the baby to take the disease, we cannot know what's the complication of the disease. Sometimes children has low immunity. This disease may kill him. So we advise all mothers to prevent this disease by vaccination. We have already in Kuwait the vaccination against chickenpox. We put this vaccination from 1 year as a 2 doses, 1 dose in the 1 year and the other dose when 6 years. Also, this vaccination for all ages, no exception for age, for adult, for children after 13 years, also for the mothers who will become pregnant, because the chickenpox, if affects the pregnant mother, I think may lead to congenital anomalies in their children.
Really?
Yeah.
Is that the case?
Yeah.
And is it possible that the mother, as she is pregnant, gets the vaccination, or is it advised to do it beforehand?
Yes, I advise all mothers who will get pregnant to take this vaccination, but don't get pregnant 1 month after the vaccination, because if they get pregnant immediately after the vaccination, this may lead to congenital anomaly in her baby.
Very interesting. And how could we prevent chickenpox?
The prevent of chicken, firstly, the vaccination. This is the only measure to prevent the chickenpox, because it prevents the infection by about 90%. And if it's coming after vaccination, slight and cannot be noticed. But don't let your baby, for all mothers, don't let your baby to get the chickenpox, because if he gets the chickenpox, he isolated in her home, in his home. No contact with
everyone.
Yes. Number 2, he cuts the school by about 3 weeks, and this is very bad for him.
Definitely, he'd miss out on a lot of educational.
So my advice for all mothers to take the vaccination. It is very safe, it is very good. There is no relation between the vaccination and any diseases, because sometimes they tell us there is a relation between the chickenpox vaccine and autism. No relation between chickenpox and autism. The chickenpox is a safe vaccine, and for all groups or of human from 1 year until 30 years.
Very interesting. And it's always important to know how to prevent chickenpox.
Yeah.
But what if, say, at school, what is the things that the teachers should do? Because if they have like a student that comes to school with chickenpox, should they send them home? What is the case here?
Firstly, me as a doctor, I advise when I discover this disease to not go to school. But sometimes the child go to school in this time for 2 weeks, all child that surround this disease can take the disease. We cannot know if the disease is transferred or not except after 2 weeks. So if the child go to school and this disease is spread, I think some school close because it's highly infectious.
Very interesting.
Yeah.
So whoever has or catches it should not go to school because
Yes.
it would spread immediately.
Yeah.
Can you tell us more about the sore throats that kids are getting nowadays?
Yeah, sore throat is a common disease also. Sore throat, this is a slight disease, but the most common disease in children is the tonsillitis. This is a very common disease.
Can you tell us the difference between both?
The tonsillitis, this is lymph node present in the front of the throat. But sore throat, this is inflammation in the throat itself. But the tonsillitis is inflammation in the tonsils. Tonsils, this is 2 lymph nodes present in the front of the...
And what about the symptoms? What are the things that we should look for in order to know and notice this type of disease with kids?
Most common symptoms in tonsillitis, fever, high-grade fever. Number 2, sometimes the symptoms of the tonsils like acute appendicitis, severe abdominal pain, vomiting, fever, and sometimes some child go to the operation theater to remove the appendix, but he has a tonsillitis. So the most common symptom is a fever, bony ache, abdominal pain, and also sometimes vomiting.
Very interesting. And how could we prevent this sort of disease?
Hygiene. Look, any disease in a child can be prevented by personal cleaning. Only one measure can we do in our home is most important, which is the hand wash. Hand wash for 30 seconds. This leads to remove of about 85% of microbes.
Very interesting.
Yeah.
And how could we avoid this type of disease?
What?
How to avoid this?
Avoid disease. Cleaning. Number 2, avoid close contact with any infectious. Number 3, fluids. Fluids is very good for people. Must wash his hand after, before eating and after bath and so on. This is a personal hygiene, protection of the baby. This is very important and most important than treatment.
Very interesting. And it's very interesting to know all this in order to avoid any certain disease in the future. Can you tell us more about the common diseases that kids may face from the surroundings, like the environment, the places, the weather? Can you tell us more about that? And what sort of factors that contribute to this as well?
Most common disease can take from the different weather here in Kuwait. Chest infections is most common. Number 2, the allergy, the most common. Number 3, the chickenpox, most common. Gastroenteritis, most common. Also, allergy like skin rash, typhoid can be transferred to the baby from the surrounding. Also, sore throat, also acute otitis media. This is a common disease in children, can take from close contact with the affected patient.
Very interesting. And now, as soon as the baby is out and a newborn, they get teeth. And when they do, they have this problem with teething.
Yes.
Can you tell us what sort of things would happen for the development of getting teeth?
Yeah, there is bad information about teething. Some mothers tell us this, my baby is teething now, but he has fever or diarrhea. There is no relation between fever or there is no relation between teething and fever.
So it's always a misunderstanding
Yes.
between the both.
Yeah, because sometimes the baby, when he's become large, he can catch anything from the surroundings. So he accepts the infection. So he can fevers, he can big diarrhea, but there is no relation between teething. There is no relation between teething and fever, between teething and diarrhea. The teething is a physiological method that occur without any complication. Baby can start teething from 6 months, may be delayed until 1 year, no problem. But the mother must take vitamin D for her children from 1 day life until he become walk without any support.
Very interesting.
Yes.
And what sort of like objects can they have? Because we tend to see that a lot of kids would have like those certain things, they grab on to anything and just try to eat it and bite it.
No.
What
this
are the
is-
things? Because we see sometimes there
No,
are
no,
like
no,
certain toys for
No.
the teeth development,
No,
or
no.
does that
Also, no,
harm
no.
the development
No,
of
no, no.
teeth?
We don't advise with that because it leads to deformity in the
actual
gum.
teeth.
Yeah,
Okay.
yeah. No, no, no. Sometimes there is some pain during teething. We advise the mother to put some gel to decrease this pain. But we don't give any toys, we don't advise for anything because all that leads to deformity in the
Yes,
gums.
definitely, and they do not want to have
Yeah.
that deformed look or teeth
Yeah.
otherwise. So, any last advice to the parents?
My message to all families is culture of the follow-up. Please, for all mothers, don't wait your child to become sick. No, you must, for your doctor, you must link with your doctor for advice, for anything. This is very important because the protection is better than treatment of any child.
Yes, so they should definitely go get an appointment right now and discover the certain things in order to avoid those diseases that you mentioned.
yeah.
Thank you so much, Dr.
Thank you,
Ashraf, for
sir.
being here
Thank
tonight
you.
with us and sharing
do I.
all those useful information.
Thank you, thank you, thank you.
It's always a pleasure to have you. We're going to cut to another report, which is the expedition of the art